Okay, so welcome to the vertebral column, or your spine. The function of the vertebral column is to protect the spinal cord, to support the head and body, and it will consist of 26 bones, 24 vertebrae, the sacrum, and the coccyx. Looking at your vertebral column here, we're going to have 7 cervical vertebrae, 12 thoracic, 5 lumbar, a sacrum, and a coccyx. One thing that you'll notice is that you do have these spinal curves, okay? The cervical and lumbar curves, as well as the thoracic curve, which is the primary curve, okay? And deviations of these curves can lead to various spinal disorders, many of which we don't really see anymore in the US because of corrective measures that can be taken into place. We'll talk more about those a little bit later on. So we have a cervical, thoracic, lumbar, and sacral curves, as indicated by that previous picture. The primary curves, these are what we refer to as accommodation curves. They are present during fetal development, and they are mainly there to accommodate the internal organs that sort of sit within those regions. The cervical and lumbar curves, these are called secondary curves or compensation curves. They appear after birth, and this is due to shifting your body weight to permit for an upright posture. Looking at the vertebrae, the general structure, again, we're going to have 7 cervical vertebrae, which is located in the neck region. We're going to have 12 thoracic. This is within the thoracic cage, or thoracic region, and then 5 lumbar, which is your lower back. Each thoracic vertebrae, by the way, will articulate with a rib. Looking at for vertebral anatomy, each vertebra is going to consist of 3 primary parts: a vertebral body, a vertebral arch, and articular processes. The vertebral body is going to be the base of the vertebrae, and this is actually going to transfer the weight along the spine. It's going to form the anterior margin of each vertebral foramen. The vertebral arch will form the posterior margin of each vertebral foramen. And then the articular processes, these are going to be lateral projections, which are actually located off the extensions of the vertebral arch. So looking here, this is the base of the vertebrae or the vertebral body. Again, this is where most of the weight's going to pass through. You can see that with our vertebral arch and the body here, we are forming what's referred to as the vertebral foramen. This vertebral foramen is what's going to allow the spinal cord to pass through this big hole right here. Other structures, spinous processes, these are the posterior projections from where the vertebral lamina will fuse. You're also going to have transverse processes, as well as superior and inferior articular processes. The superior and inferior articular processes are going to be little joints that actually form interlocking connections between each of the vertebrae. So looking here, you can see the superior and the inferior. So superior on this side, inferior on this side. We're looking at an inferior view, by the way. Articular processes, again, these are going to form interlockings with the vertebrae on top and below, depending on what you're looking at. And then, as I mentioned, that vertebral foramen is actually going to be the big hole in which the spinal cord will pass through. Intervertebral disc, these are pads of fibrocartilage. Make sure you know the type of cartilage that's found in between the vertebrae. The only other area you're going to find fibrocartilage we'll talk about when we get to the appendicular skeleton with the hip is the point of attachment where the 2 hip joints, the joint between the 2 hips meets. The intervertebral foramen, these are gaps between the pedicles of the adjacent vertebrae. And this particular opening is going to allow the spinal nerves to come off of the spinal cord and pass through each of the vertebrae on either side of the body. The vertebral canal, this will enclose the spinal cord. So looking here, we can see these intervertebral discs between each of the vertebrae here. These discs are very important because as the weight gets pushed down this spinal column here, it's these discs that are, sort of buffering between the bone-on-bone interaction here. It is very, very painful if a vertebrae rubs up against a vertebrae. And sometimes what can happen is sometimes with enough compression, these discs can actually bulge out a little bit. And depending on where the bulging is occurring, that could actually be putting pressure onto a spinal nerve, or worse yet, your spinal cord. And if that's the case, that could be a little problematic, in which case they'll go in, they'll either excise the intervertebral disc, and if they remove the intervertebral disc, or if it's bulging too much that they need to remove it, what they will then do is put little plates next to connecting this vertebrae to this one and this one to this one, so that the two vertebrae are immovable with each other and you're not getting that bone-on-bone rubbing. Okay, vertebrae are numbered, which is an easy thing. At least they didn't give all 26 vertebrae a different name. And they are also going to have their regional names. As I mentioned, we have cervical, thoracic, lumbar, sacral, and the coccyx. So your cervical vertebrae, you have 7 of those, C1 through C7. The cervical vertebrae are going to have a very small body. They're only supporting the head. They're not supporting most of the weight of the body. They will have a very large vertebral foramen, actually the largest part of the spinal cord. They will have a concave superior surface, and the anterior edge is inferior to the posterior edge. Looking at the transverse processes are going to be fused to costal processes, and they will encircle the transverse foramen for the vertebral arteries and vertebral veins. The spinous processes coming off of the cervical vertebrae are going to be bifid, which looks like more of like a little bit of a hatchet, and we'll see a picture of this in a second. Whiplash, which is partial or complete dislocation of a cervical vertebrae in what we call a head-neck injury. So here you could look, these are the spinous processes coming off the cervical vertebrae here, and they sort of have this little bit of a hatchet-like look, and that's what we refer to as bifid. All right, and you can sort of see this little indentation here, giving that bifid definition. The bodies are right here. Again, the bodies are going to be the smallest of your overall vertebrae. If you note that the further you go down the spine here, the larger the body gets. C1, this is a typical vertebrae for cervical. This would be your typical vertebrae for C3 through C7. And again, looking at the typical lateral view of a cervical vertebrae. C1 and C2 are a little bit special. They look a little bit differently, and they actually have different names. C1 is referred to as the atlas. This will articulate with the occipital condyles of the skull. It has no body or spinous process, and it has a large round vertebral foramen within the anterior and posterior arches. C2 is referred to as the axis. This will articulate with the atlas. It is a heavy spinous process to attach muscles to the head and neck. It also has a perpendicular structure sticking out called the dens, which is going to allow for rotation of the head, such as turning your head as shaking your head no. Left to right, shaking your head left to right. So here we can see C1 and C2 sort of interlocked with each other. C1 is up here. This is going to be, the occipital condyles here would fit right into here of the base of the occipital bone. You can see the dens. This is part of C2 here, sort of anchored in there. This is going to allow for rotation. I know I'm moving my hands a lot that you can see. But it's going to allow for rotation of the head and shaking your head no. The occipital condyles are going to sit in a manner here that are going to allow your head to rock back and forth, such as shaking your head yes. So C1 is important for shaking your head back and forth. It's also the base of holding the base of the skull. C2 is important in shaking your head no in that movement. C7, this is actually going to be a transition vertebrae to that of the thoracic. They have long spinous processes, broad tubercle, and very large transverse process. Your thoracic vertebrae, they have heart-shaped bodies. The bodies are a little bit larger than what we see with the cervical, and they have very long, slender spinous processes. This is what you typically feel when you run down somebody's back. Those little bumps is really going to be these spinous processes. They're also going to have costal facets. These are going to be articulation points for the heads of the ribs. So looking at the thoracic vertebrae, T1 through T8 each articulate with 2 pairs of ribs. T9 through T11 will articulate with 1 pair of ribs. T1 through T10 are all going to have thick transverse processes. Rib pairs 1 through 10 will contact costal cartilages. Will have contact via costal and transverse facets on the the thoracic vertebrae. T10 and T through T12 are going to start to transition into the lumbar vertebrae. So here you can see your thoracic vertebrae and how they're all interlocked with each other. When we were saying T1 through T8 are going to articulate with 2 pairs of ribs, it's that the bottom of one will articulate with the top of the other, and so on. So they sort of interlock in. Looking at the typical thoracic vertebrae here, we can see a transverse costal facet right here and a superior articular facet here. So what's going to happen is the rib's going to articulate here and make another attachment point here. If we're sort of looking at a lateral view, you can see it will attach here and then attach here. And then what's going to happen is the rib's going to spin around and attach via cartilage to the breastbone. Your lumbar vertebrae, these are your largest vertebrae. They have very thick oval-shaped bodies. There are no costal facets or transverse costal facets. They have a triangular vertebral foramen. And they also have massive spinous processes, and that's really for attachment of the very large back muscles. The bodies are big because this is where a bulk of your weight is going to be transmitted down. Here you can see. One thing I want to point out is that the vertebral foramen of the lumbar vertebrae and that of the cervical vertebrae is much larger than the vertebral foramen of the thoracic vertebrae. And when we talk about the spinal cord in the nervous system, you're going to see that the spinal cord actually enlarges in a cervical region and a lumbar region. And the reason why you see that enlargement of the spinal cord in those regions is in the cervical region, you have the arms that are going to come off, so you have more nerve supply to the arms. And in the lumbar region, you're going to see a thicker cord because you have the legs coming off there with more nerve supply. For the thoracic region, it's just the thoracic cage that you have the nerve supply for. And this is looking at a typical lumbar vertebrae. So here are the 3 vertebrae, the 3 types: cervical, thoracic, and lumbar. Please make sure you're able to identify the differences between the 2. There are distinct differences between the 3. Okay. The sacrum and the coccyx. L5 will articulate with the sacrum, and the sacrum will articulate with the coccyx. The sacrum is curved, more so in males than females, and it protects the reproductive, urinary, and digestive organs. It's also going to attach to the axial skeleton, to the pelvic girdle, which is going to be the hip joint, and subsequently the attachment of the lower limb. The sacrum also will allow for broad muscles, that are going to attach for movement of the thigh. The adult sacrum will consist of 5. I've seen 6, sometimes 4, fused sacral vertebrae. The fusion occurs between puberty and ages 25 to 30. Let's see. Looking at the sacrum, these are just some angles and edges of the sacrum. I'm not too concerned that you guys are familiar with all of those. The coccyx, mature coccyx, will consist of 3 to 5 fused coccygeal vertebrae. The coccyx is going to attach ligaments and a constricting muscle of the anus. The first 2 coccygeal vertebrae will have transverse processes and unfused vertebral arches. And this is more commonly referred to as your tailbone. Okay, so here you can see your sacrum, this structure here, and then the coccyx. So the sacrum sort of angling into the screen, the coccyx is angling out of the screen. Looking at that, as you can see here. Okay, you can see the sacral curve right there that's formed. All right, the thoracic cage. This is the skeleton of the chest. It consists of the thoracic vertebrae, your ribs, costal cartilages, and your sternum. Here is your thoracic cage. So we can see we have 12 pairs of ribs on either side for a total of 24 ribs. You can see the 12 thoracic vertebrae in the posterior part there. And then we also have our breastbone or sternum right here. The breastbone is actually going to be made up of 3 portions: the manubrium, which is this square or rectangular-ish looking structure right here, the body, this long part right here, and then what we call the xiphoid process, which actually remains as hyaline cartilage until about the age of 45, in which case then it ossifies to bone. That's why in this picture it's actually sort of looks like this dark red color, which is indicating the hyaline cartilage or the costal cartilage attaching the ribs to the breastbone. This is looking at the posterior view. You can see the articulation of the ribs, the 12 pairs of ribs to the thoracic vertebrae here. This is actually a great image. Functions of the thoracic cage: it protects the organs of the thoracic cavity, including the heart, lungs, and the thymus gland. Provides the attachment for muscles involved in breathing, maintaining position of the vertebral column, and moving the pectoral girdles. The ribs and sternum will actually form the rib cage. So your ribs, you have 12 pairs of long, curved, flat bones extending from the thoracic vertebrae, and we have what are called true ribs and false ribs. Ribs 1 through 7 are true ribs. Why are they called true ribs? Because they are directly attached to the sternum by their costal cartilage. Ribs 8 through 12 are referred to as false ribs because they do not directly attach to the sternum by their costal cartilages, or may not at all. We have ribs 8 through 10, which are referred to as vertebrochondral ribs. The cartilage of ribs 8 through 10 will actually fuse into the cartilage of rib number 7. And then you have 2 floating pairs of ribs, number 11 and 12, where they do not actually attach to the sternum at all. Looking at the structure of a rib, you have the head, which is referred to as the capitulum. This is at the vertebral end of the rib. And then the neck, this is the short area between the head and the tubercle. The tubercle is actually going to essentially excuse me, sorry, I had to sneeze there for a second. The tubercle is actually going to attach to the cartilage end, which will attach to the breastbone. Okay. And if we look at the rib here, you know, you can sort of see the head right here, which is attached directly to the thoracic vertebrae. Here you can see the second attachment point, the angle, and then the rib will ratchet around, and you'll have the sternal end of the rib right here, which is going to be attached, if this was ribs 1 through 7, through cartilage directly to the sternum. Ribs 8 through 10, cartilage would actually attach to the cartilage of rib number 7. If this was rib 11 and 12, it would just, that would be it. It would just end right there. Your breastbone, this is a flat bone in the anterior midline of the thoracic wall. It's also referred to as the breastbone. The sternum contains 3 parts: manubrium, body, and xiphoid process. The manubrium is the superior portion of the sternum. It has a broad triangular shape. This will articulate with the clavicles, which are referred to as your collarbones. It will also articulate with the cartilages of the first rib pair. It has the jugular notch, which will allow, which is a shallow indentation between the clavicular articulations. The body is a tongue-shaped structure of the bone. It attaches to the manubrium, and it also attaches to the costal cartilages of rib pairs 2 through 7. The xiphoid process is the smallest part of the sternum. It attaches to the sternal body. It also attaches to the diaphragm and the rectus abdominis muscles. The diaphragm is going to form the floor of the thoracic cavity and is your primary breathing muscle. The rectus abdominis muscles, this is what we commonly refer to as your 6-pack abs. The developing sternal body consists of 4 separate bones. Fusion is not complete until the age of 25. And the xiphoid process, this is the last part of the sternum to ossify and fuse. It can be broken very easily. And as I said, for most individuals, it will completely ossify around the age of 40 to 45. Okay, and that is our axial skeleton. As you guys are studying this, you know, you might find yourselves a little overwhelmed, especially with the skull. The skull is going to be the most difficult part of all of the bones. Out of all 206 bones, those 22 bones that make up the skull and the various structures associated with them, that is going to be the most difficult portion. It will probably take you just as much time to do those 22 bones as it will to do the rest of the skeleton, including the appendicular skeleton. Because when you get to the appendicular skeleton, you know, yes, it's 126 bones, but, you know, half of them are found on one side, the other half are found on the other side. So you're doubled up there. And you have many bones that actually are just fingers and toes. So, you know, the numbers kind of get down very quickly, and it's not as bad. The appendicular skeleton is not as bad as, you know, the axial skeleton, and especially that skull. That skull is a very, very difficult structure, and I would suspect that's where most of you are going to spend a bulk of your time. Okay, have a good one, guys.